Hey guys, right now I'm outside the T-stop waiting for my bus and wanted to just take this time to share with you some notes that we took this past week. I'm an outpatient pediatric surgeon, so learning a lot of family-oriented stuff. And today, just wanted to share with you what happens when your teeth gets knocked out. So let's say you're playing baseball, or your child's playing baseball, or you're walking down the sidewalk, you slip, and it's a little windy, but let's say you walk down the sidewalk, you hit, you slip, and the entire tooth gets knocked out. So in your child's case, if it's not the baby teeth, but the teeth that have grown out, the adult permanent teeth, if those get knocked out, what do you do? And do you wash it in water, or do you just store it cleanly in a paper towel with alcohol, or do you wash it in milk, store it in milk, or do you put it right back in? And surprisingly, the answer is you try to put it right back in immediately. And you don't have to worry about if it's going to get infected, because when you go to the hospital afterwards, they'll give you antibiotics. But the goal is to put it right back in immediately. The worst thing to do is to wash it in water, because water will lyse the periodontal ligament cells that are that are surrounding the teeth. Those cells are really important to help you reattach the tooth back into the mouth. And if you wash those away with water, then it's kind of game over for the tooth. But a lot of parents, unfortunately, what they do is they will rinse it in water, store it nicely in a paper towel, and then take that tooth, present it to the doctor, and by that time the tooth is no longer going to be able to put back in the mouth. There's actually an interesting case story where a boy, he kept getting his tooth knocked out for some reason. I think maybe playing sports or something like that, and he was afraid his parents would get really angry, so he ended up he would put the teeth back in himself, put the tooth back in himself. And actually that's something that, if the parent is not feeling comfortable putting the tooth back in, it's making them feel a little queasy, a little uncomfortable, then just ask the child to do it. But in this case story, the child kept putting it back in, and then one day he put it back in backwards, and then the tooth just kind of reattached backwards. So the teeth, as long as you don't wash away the ligament, periodontal ligament cells, the teeth should be good to go. And if you absolutely must store the tooth in some kind of liquid, then please use milk or HBSS, but most people don't have HBSS. Milk is a very good alternative. And then go immediately in the hospital. You want to try to get the tooth reattached within 60 minutes, preferably within 5 minutes. Just put it back in, but anything over 60 minutes would be just too long. So it is considered an emergency. It's not a heart attack, but it is considered an emergency that you want to get to the hospital as soon as possible. So I hope that is of help, and I will try to post up more stuff about medical school interview and things like that later. And thanks for listening. Thank you.